Hi, my name is Brad Kegley. Today I'm going to be hanging a primary bag of fluid on a patient. I've already gathered all my supplies. I've already checked the doctor's orders. The doctor has ordered just a normal bag of saline to be placed. I've already got all my supplies and everything else. I'm going to walk into the patient's room, I'm going to wash my hands. I'm going to put on my gloves. While I'm putting on my gloves, I'm going to be talking to the patient, interacting with them. Going to verify the name, date of birth. I can check that against the wristband. And as I have all my supplies right here, I have my flush. I'm going to inspect the IV site. He already has a 20 gauge IV established. I'm going to check the site for any redness, any swelling, any tenderness. Make sure that he is in no pain, which he is not. This time, I'll take alcohol wipe. You can wipe off the port. I'm going to hook up, flush, unclamp the IV. Going to pull back, see if I can get any blood return. And there is. So I'm going to use the push stop method. The IV has patency. Close off the port for right now. I have my tubing here. I'm going to undo the tubing. I'm going to get my bag of saline. At this point, I can spike the bag. I'm going to hang the bag here, make sure that everything is clamped off. Prime the chamber. I can come back over to the patient, clean the port once again. Going to open up my tubing, get it to prime, get all the air bubbles out. Alright, that's good. Clamp it back off. Hook the tubing up to the patient. Unclamp. Going to open the line back up and establish the drop rate that is 20 drops per minute. You can count the drops. Okay, that is 20 drops per minute going, and at this point I can clean up all my supplies that I brought in with me, make sure that there is no redness on the site or around the site, make sure that the IV isn't infiltrated at all, make sure that the patient is comfortable. And I'm going to also put the name on the tubing and patient's initials and the time that the tubing was hung. I'm going to get all my supplies, go outside, want to document the patient's name, where the IV is, 20 gauge, and the right hand, what was started, the time that it was started at, and that'll conclude the primary IV fluids.